Hello, my name is Dr. Dewan S. Raja. Today I will discuss about spermatogenesis. We have some questions and we have answers. So what is spermatogenesis? Spermatogenesis is the process of development of spermatozoa from Spermatogonia. When does the spermatogenesis begin? It begins at puberty and it will continue throughout the life, even in the old age. What is the male gamete? The male gamete is the spermatozoa. These are the male gamete. What is the female? What is the female gonad? Female gonad is the ovary. What is the male gonad? The male gonad is the testis. This is the male gonad. This is the male gamete. Female gonad is the ovary and female gamete is the ovum. Where does the primordial germ cell remain dormant? The primordial germ cells, they are developed in the wall of the yolk sac and they migrate to the testis around after 6 weeks of intrauterine life. From the yolk sac, they migrate towards the testis and they will remain in the testis in the dormant stage up to puberty. Okay, what are the type A, type B cell? Okay, so in the process of spermatogenesis, what happened? The spermatogonium will continue to form the type A, type B cell by mitosis. Type A cell will remain a stem cell and type B cell will continue in the cell division. So we got that in the meiotic cell division. Okay, so this is the meiotic cell division here, and spermatogonium goes through multiple mitosis, and we have two distinct type of cells. The type A cell, they are the precursor or the stem cell, and the type B cell that will go through the meiosis. Okay, so we got the stem cell, that is these cells are the Spermatogonia type A cell. What is the number of chromosomes and amount of DNA that are present in the primordial germ cell? In the primordial germ cell, we should have 46 chromosomes, 2n DNA. 46 and 2n DNA. Okay. What is the number of chromosomes and amount of DNA that are present in the primordial germ cell? What is the number of chromosomes and amount of DNA that are present in the primary spermatocyte? Okay, so here we'll go through from the spermatogonia. Okay, so we'll get the spermatogonia. Spermatogonia will proliferate by mitotic cell division inside the testis, and before the first meiotic division, it will be the spermatogonia B will be the primary spermatocyte, and primary spermatocyte will replicate its DNA. So here we'll have 46 chromosome, 4n DNA. 2n DNA become 4n due to replication. Okay, so that is spermatogonia proliferate by mitotic cell division inside the testis, and just before the meiotic cell division, the primary spermatocyte will replicate. It will get 46 chromosome plus 4n DNA. Then meiotic division 1 will get secondary spermatocyte. Here we'll get the 23 chromosome plus 2n DNA. 23, 2n. Then second meiotic division is completed. We'll get spermatid. Here we'll get 23 chromosome and 1n DNA. So 4n, 2n, 1n. Here 46 chromosome, 23 chromosome, 23 chromosome. We call it haploid chromosome. 23. Okay. What is the number of chromosome and amount of DNA that are present in the primary spermatocyte? Primary spermatocyte, before the meiotic division, should have 46 chromosome and 4N DNA. What are the stages of the spermatogenesis? Okay, we got that Spermatogonia, that is usually Spermatogonia B, then primary spermatocyte, secondary spermatocyte, spermatid. From spermatid, no more cell division. This is just morphological change. That is called spermiogenesis. So there will be differentiation in the shape and size, and there will be tail addition here, and we'll get the spermatozoa. This is the spermiogenesis. Okay. What are the stages of spermatogenesis? What happens in Meiosis I? In Meiosis I, there will be the homologous chromosome will come together. There will be exchange of genetic material. Okay, then they will be separate out the homologous chromosome. Okay, so that is the idea of the Meiosis I. Genetic exchange without any split in the centromere, just there will be crossing and pairing and crossing. We call it synapsis. Okay. What is the outcome of Meiosis I? We got different after Meiosis I, meiotic division will get the secondary spermatocyte. Okay. So genetic material has been exchanged between the homologous chromosome, and after Meiosis I, we should have here 23 chromosome and 2N DNA. When does the centromere split? Centromere split during the second meiotic division. The centromere splits. Here it is split. Here it will be split. This is the centromere. Okay. What is the number of chromosome and amount of DNA present in the spermatid? In the spermatid, we'll get haploid number of chromosomes, that is 23, and 1N DNA. Okay, so we are here. The changes in the spermatid into spermatozoa is the spermiogenesis. What are the changes in the spermiogenesis? This is the spermatid. Look at that. The spermatid will lose a lot of cytoplasm. There will be thickening of the nucleus. The Golgi apparatus will make the acrosome, and there will be arrangement of the mitochondria around the middle piece. Okay, and around the centriole we have the microtubule will form the tail. So tail will be enlarged. We call it flagella. This cell. This is a cell with 23 chromosome, 1N DNA. Okay. Nuclear condensation must. Nuclear condensation will keep all the nuclear material together, and it will help in penetration of the ovum by the spermatozoa. Golgi apparatus will form the acrosome cap. Okay, is formed by the Golgi apparatus. What is the mitochondria? Mitochondria will be arranged around the middle piece. How the tail is formed? Tail is formed around the centriole and by means of the microtubules. Okay, what is the function of the Sertoli cell in spermatogenesis? We have the Sertoli cell. Sertoli cell protects, nourish, and secretes the maturing or developing spermatocytes. It also maintains the blood-testis barrier. Okay, it supports, protects, and matures the spermatogenic cells. What are the hormones associated with spermatogenesis? We have two hormones, luteinizing hormone and the follicle stimulating hormone. Follicle stimulating hormone will work on the interstitial cells of Leydig. Luteinizing hormone will work mostly on the Sertoli cells. Okay, we have the Sertoli cells here. Okay. Okay. Then this is the lumen of the seminiferous tubule. These are the seminiferous tubule. This is the lobule of the testis. This is the rete testis. This is the mediastinum testis. This is the epididymis. The spermatozoa will go here and it will be mature here, tail will be enlarged, and spermatozoa will be motile while it is in the epididymis. This is the seminiferous tubule. This is a section of seminiferous tubule. We have the myeloid cell, we have the Spermatogonia cell, we have the primary spermatocyte here, the Sertoli cell, the late Spermatid cell. Okay. What is the time required for the Spermatogonium to develop into a mature spermatozoa? It is around 73 days. How many sperm cells are produced daily? It is about 300 million. Where does the spermatozoa obtain full motility? That is in the epididymis. This is the epididymis. Okay, we'll have some clinical notes. Abnormal gametes. What is the gamete? Spermatozoa. About 10% of all spermatozoa have observable defects. The head of the tail may be abnormal, very large, very small, or they may be conjoined together. This leads to lack of motility and male infertility if their number is too high. Okay, around 10% acceptable. If most of the cells are like this cell unable to fertilize. Non-disjunction during meiosis, maybe meiosis during meiosis I or meiosis II. If the separation of the homologous chromosome fails, one cell receives more chromosome, other cell receives less chromosome. So we have some genetic diseases, chromosomal disorder happen due to non-disjunction. Okay. Kartagener syndrome or immotile cilia syndrome. This syndrome is present maybe 1 in 10,000, even more. Okay, what are the manifestations? There will be immotile spermatozoa, the flagella will not move, so there will be no fertility. There will be male infertility. There will be constant respiratory problem because immotile cilia, there will be sinusitis, pharyngitis, pneumonia, and there may be situs inversus. The viscera, the lungs, liver, that will be alteredly, they will be reversely oriented. Okay, there may be dextrocardia along with that. That is, this all together may form Kartagener syndrome. Okay, that may also lead to male infertility, chronic respiratory problem. Okay, and that's all about the spermatogenesis. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me, and have a nice day. Bye now.